The Competition Commission is investigating the price of COVID-19 PCR tests. The travelers and holidaymakers are required to take the test, but many believe it's too expensive. It's reported that labs charge 1,000 rand and more for these tests. The Commission says it doesn't understand why the price of the test hasn't been reduced. So let's speak now to the Chief Economist at the Competition Commission of South Africa, James Hodge. James, thank you for making time. What are you going to be looking into exactly as the Competition Commission?
Well, I think as we've been saying last week, the price of COVID tests came down to 850 Rand very early on in the pandemic because of an intervention we made, granting the healthcare funders an exemption to negotiate the price to a more reasonable level. Prior to that, you were seeing prices as high as 1,500 Rand. But since those very first days of the pandemic, when few tests were actually being conducted, we have gone through, I think it was reported today in the Business Day, 18 million tests, almost 10 million in the private sector alone. And the volume was inconceivable at the time, and yet the price hasn't come down from that 850 that was initially set. And this we find remarkable because we know for a fact that testing kits have come down in price, probably halved in price, meaning at least 150 Rand in savings there. But also the scale of testing that's now happening, there must be a reduction in costs as well. So that's why we're concerned. The Department of Health is concerned. The Council for Medical Schemes is concerned. As we saw reported today, so are a number of funders. Everyone believes that the price should be coming down and yet isn't. So that's the reason for our concern. We don't want to go into a fourth wave and see the massive escalation in testing with the prices still where they are today.
So how have they been explaining this? The factors that you've mentioned, the input costs that have been falling and yet the prices are staying the same. What are these, big private laboratories? How are they explaining it?
Well, we are at the early stage, so we are deciding what course of action is best taken at this stage. The objective is to bring the price down as fast as possible to a level that can provide a normal return on your business, but not excessive. So at this stage, I think there has been, what we're understanding, a bit of resistance from further reductions, assurances that these are meant to be in line with costs, but no actual intervention to determine what their costs are. So I think for us at this stage, if we officially launch the investigation, we would be interrogating those costs at a detailed level. And if found to be excessive, then we would, take the parties to court and fine them, as we have been doing with price gouges all through this pandemic.
Yeah. Who are these, the big players? Who are the biggest players here? And have you managed to check how much they charge versus how much government is charging for the tests?
So the main players in testing would be your pathology labs, and then also your retail pharmacies have also expanded into the space, so your big pharmacy groups. But the government labs, the National Health Laboratory Services, charges 650, and that's to private patients, and even less when they're charging intergovernmentally. So they've consistently charged at a discount to the private testing. And it's not clear that they have significantly lower costs. I mean, they do run a substantial number of tests, and maybe more than some of the individual pathology labs, but the price difference doesn't seem explainable by that.
And in terms of, you mentioned earlier that testing volumes are expected to ramp up. Are you expecting that as the Competition Commission that you would have perhaps completed your investigation soon, and as the testing ramps up and then the prices are not as exorbitant as they currently are?
Well, we would, if the prices at the moment are well above what they should be, we would want them to come down before any new wave. What we see in terms of the patterns, as soon as one goes into a wave of infections, then the amount of testing ramps up, and you can understand that. More people are affected, they're suddenly getting symptoms, and they need to go and do tests. Businesses, travel, all start to demand tests, certainly when there is a wave, in order to protect people, the employees. So So we would think if that is likely to happen in December, as is the current projection, then we would want to get these prices down beforehand. And that's why just looking at the choice of instruments we have to bring this down faster to the benefit of consumers and the healthcare funders, then the better. You know, I think one forgets that although medical schemes may fund some tests, the vast majority of tests are paid out of pocket by consumers. And at a time when people are out of work, incomes are stretched, that to now add additional burden of a high cost of a test on that person is not in the interest of the country.
All right. Chief Economist at the Competition Commission of South Africa, James Hodge, I really appreciate your time. Let's take a look now at